this is Hillary with the Nurse Preceptor channel. I'm glad you're back. This is video number 9 in my 30 Preps in 30 Days series for the month of September. This is National Preparedness Month. My topic today is essential purchases for microbial control. Specifically, these are solutions that you will want to purchase that are commercially available and mostly inexpensive that can help to disinfect your skin and to also disinfect your environment around you, because we all remember in early 2020 when all of the hand sanitizer, all of the bleach, all of the alcohol, all of the hand wipes and everything sold out like almost overnight. And we don't want that to happen again, but if you have a few of these items in your arsenal, you can actually make your own hand sanitizer and your own cleansing wipes for your home. Before I forget to mention, please like my video if you find it to be helpful at all, and I would love for you to subscribe to my channel. Hands down, one of my favorites for my own arsenal is bleach. I love chlorine bleach. Sodium hypochlorite is the active ingredient. Your standard bleach comes in a 5% concentration. If you mix 1 part of that bleach with 99 parts of water, then you have effectively diluted it enough where you can use it as a topical preparation to help decrease bacteria and fungi on the skin. In addition, you can also use bleach not only as a skin disinfectant, but you can use it as a disinfectant for your environment. And keep in mind, if you put bleach on anything that's colored or porous, like material, it may possibly discolor it. The other thing about chlorine bleach is that the fumes can be pretty noxious and it can cause some respiratory irritation. So only use it in a really ventilated area. I did want to mention that dilute bleach baths can actually be used on skin like the feet, if you're trying to fight a case of athlete's foot that just won't resolve very well. You can use that dilute bleach solution on the feet. Just make sure you rinse afterward to get the extra chlorine off of the skin. Probably my second favorite item to have as far as disinfecting solutions is alcohol. I like 70% isopropyl alcohol, which is your typical rubbing alcohol. And if you look at the back of a lot of hand sanitizer bottles, I don't know if you can see this very well, but that is actually ethyl alcohol, but they are both considered equivalent in terms of their range against a number of different bacteria. Alcohol is typically what you find in hand sanitizers, and we tend to use it only in small amounts on the skin because it's so drying. For example, we'll use it as a skin prep just prior to doing an injection or starting an IV. Now, you can make your own hand sanitizer out of this alcohol. You would need to have some kind of a mixture that you can put it in, like aloe vera, something that's going to help moisturize the skin and carry the alcohol as well. And one really good idea is that if you don't have any surface wipes and you want to have some available, like to wipe down shoes when you come in the house and things like that, or to, wipe off, say, like a piece of equipment that needs to be cleaned. You can take construction wipes that you can buy at like the hardware store, like plain construction wipes, and pour a bunch of alcohol on them and keep them sealed. And then you'll have automatic alcohol wipes at your disposal. Alcohol is flammable. Do not use it in the presence of any open flames or heat sources. And avoid using on non-intact skin or mucous membranes because it stings really badly. My next favorite item is hydrogen peroxide. This runs about $1 at the store. It's, of course, very, very good as far as its price point. And it has a really wide antimicrobial range against different viruses, bacteria, and even things like tuberculosis and fungi. It also works on fungal spores, which is really, really awesome. It can also be sprayed on fabric. It is one of the best things for taking blood stains out of clothing. It is also very good at disinfecting fabric. So one more use for the hydrogen peroxide that you really can't use bleach for. Now, back when I was a kid, if I scraped up my knee, my mom would pour the hydrogen peroxide all over my knee and it would foam up, it would get bubbly, and it kind of stung. We don't recommend doing that anymore because if you use hydrogen peroxide on non-intact skin, it has a tendency to damage the healthy tissue at the wound base, and it's going to take longer for your wound to heal. Next is iodine. I'm going to talk about povidone iodine, which is one of the ones we use in the hospital quite a bit. We use it as a skin prep for surgery, and it can also be used as a hand wash to help kill bacteria. It also works against viruses, which is nice. I will say that it has a tendency to stain, so it is limited in its use. I wouldn't use this on any kind of porous fabric, and really it's not an effective disinfectant when you're using it on hard surfaces. It is pretty much limited just for skin. For the amount of money that it costs, because it was about like an $8 bottle, you could actually get a lot more peroxide and alcohol for the same amount. And finally, I'm going to mention chlorhexidine, or Hibiclens as it's commercially known. It's a chemical scrub that is used as a hand prep before surgery, as well as a surgical skin prep over the area that is being operated on. So a couple things about it. First of all, that bottle is about $15. It's really, really expensive. Second of all, you can use it in the mouth as an oral rinse. You can dilute it down. It tastes horrible. It tastes kind of like really bad soap, and it will leave brown stains on the teeth, and that might limit its use to some people. I had to use this after oral surgery, and it did leave some almost tartar-like brown stains on the back of my teeth, and I had to go to the dentist and have her scrape it off. And really, chlorhexidine has an excellent profile against all different types of bacteria as well as fungi, but it doesn't work on spores, and it has really limited efficacy on viruses. So for that price point, I think we can do a little bit better. But if you have extra money and really want to add some to your kit, there's nothing wrong with it. Some of the other solutions provide you more benefit for a much lower price point. So hopefully that helped. And I just want to note, if you have bleach, alcohol, and peroxide, you basically have enough in your arsenal to cover most of the microbes that are out there in the environment. And you also have enough to make your own hand sanitizer, your own hand scrub, and your own cleanser for the environment. Please hit the like button and hit the bell if you want notifications of when my next video comes out. Okay, until then, this is Hillary, the nurse preceptor, signing off.